Hi, my name is Alex Casey and have recently had an initial consultation with Client X, which I will eventually hand over to another exercise physiologist. This presentation will show an overview of the client and their current lifestyle and why the client has come to see an exercise physiologist. It also shows the pre-screening process taking place to ensure that the client is safely ready to exercise, as well as any other important information the client may need to share. From here, we will then set the client 3 minor goals, one being health-related, one being behavior-related, and one being exercise-related. At this time, the practitioner will also set goals in this deconstructed format. Once these goals are set, a needs analysis is made and an action plan put into place. The client is a male, 29 years of age. He weighs 68 kilograms and stands at 179 centimeters tall. This therefore gives him a BMI of 21.2 and has a blood pressure of 127/84. Both his BMI and blood pressure place him in a normal range according to the Australian Department of Health and the American College of Sports Medicine respectively. The client has come to see me to work on running performance with an emphasis placed on the monitoring of lower back pain. He claims to have poor hip range of motion causing pain and believes it could be impeding any progression in running. His overall goal is to compete in his first. Before any more information was gathered, the client went through a pre-screening process. This was put in place to make sure, firstly, that the client is ready to exercise, and secondly, allow the allied health professional to become aware of any possible contraindications the client may have. For this client, we use 7 tools, which include 3 from the QUT Health Clinic, which are the new client screen form, initial consultation form, and informed consent form. We also used the PAR-Q, Risk Factors for Coronary Heart Disease Lifestyle Assessment Form, and the ESSA Fitness Australia SMA Adult Pre-Screening Tool. The Risk Factors for Coronary Heart Disease and Lifestyle Assessment Form both show good results. However, the results from the PAR-Q and the Adult Pre-Screening Tool showed some implications. Due to the client answering yes to one or more questions on the PAR-Q and one or more questions on the Adult Pre-Screening Tool, guidance from the general practitioner is needed before the client can commence physical activity. From the initial consultation, we found that the client works 4 to 5 times a week, attends university 3 times a week, and goes to the gym 3 times a week. Some really important notes which were taken is that the client cycles to and from work and university and has a strong swimming background. The client has no major injuries in the past 10 years, with his lower back pain being the only factor which may impede him from certain exercises. After gathering this information, the following goals have been set. The client's health goal is to increase strength in the lower body. His behavior goal is to commit to the program assigned, even given his busy work schedule. And his exercise goal is to increase aerobic power. My health-related practitioner goal is to develop time-effective resistance program to develop lower body strength. My behavior goal is to implement time strategy plans and motivational exercise to help the client complete the program. And my exercise goal is to increase aerobic power through both short and long high-intensity interval workouts. Comparing the client's anthropometry data to the AIS data for male triathletes, the client falls into these ranges nicely. It was decided that to improve running performance that the client is to undergo a 12-week program before competing. This incorporates lower body strength and power, range of motion exercises for the hip, knee and ankle, as well as prehabilitation exercises to strengthen important musculature that support these joint structures. Saunders of 2006 mentions that plyometrics invoke specific neural adaptations which can improve running economy. Spiker of 2012 says that 78% of injuries in triathlons are sustained from the running leg of the sport. Hip and lower leg injuries are the sites to 10 to 20% of injuries. However, the most common site of injuries occur in the knee at 22 to 30%. Separate to this, some high-intensity interval workouts will also be added in the sessions strategically. These will be carefully devised so that the client can still dedicate time to the swimming leg without adding more load to his daily activities. Sealer of 2013 said that interval training done once a week at 32 minutes, around 90% of his heart rate max, stimulated moderate to large improvements in both maximal and submaximal performance indicators. This suits the client perfectly as it is time efficient and works on both his behavior and exercise goals. In summary, the client is a 29-year-old male student who needs clearance from a GP to commence physical activity. He has a strong swimming and cycling leg but wants to improve running performance so he can compete in his first triathlon. The action plan is to test his 3RM squat and deadlift, a 2-phase treadmill test hip, knee and ankle mobility, perform a Bouchard's 3-day activity questionnaire, provide a 12-week resistance training program, prehabilitation exercises, a high-intensity interval training workout. Work with the client to ensure that the program is maintainable and goals remain the sole focus. Thank you.